Okay, magandang inyo lahat. Next Gen Nurse here. Ngayon, pag-usapan muna natin ang isa sa pinaka-high yield ng mga concepts sa respiratory system, and that is your COPD. Okay, your chronic obstructive pulmonary disease. Ano nga ba tong chronic obstructive pulmonary disease or COPD natin? Okay, COPD, isa to or tong mga diseases na to, because this is an umbrella term, isa to sila sa pinaka-common ng mga diseases na makikita natin sa mga Pilipino. Kaya usually hindi talaga ito nawawala sa board exam, or every now and then, usually mga 2 years or every 1 year interval yung progression ng makikita natin na pinapalabas talaga tong COPD ng mga question na to sa board exam. Bakit nga ba? Because COPD is usually caused by irritants and inhalation of mga pollutants na makikita natin sa environment. And usually, napaka-common na cause ng COPD natin is your cigarette smoking, which is rampant in Filipino males. Kaya makikita natin COPD is common in Filipino males. Kaya usually makikita natin to sa clinical setting. Kaya ang ginagawa ng BON, ini-integrate nila ito sa board exam natin. Okay? So, ano nga ba ang COPD natin? What is COPD? Your COPD is a preventable and treatable disease with airflow limitation. Anong ibig sabihin ng preventable and treatable? Meaning yan, nagagamot. Okay? Meaning na preventable, meaning na iiwasan. Okay? Pwede kang mag-decide na mag-stop, na manigarilyo. Pwede ka ring umiwas sa mga pollutants na nasa environment po, kagaya ng secondhand smoke. Pwede din na treatable. Anong ibig sabihin na treatable? Meaning yan guys, pwedeng nagagamot. May gamot ang COPD. Okay, so anong ibig sabihin ng airflow limitation? Kasi pag-usapan natin yan mamaya sa pathophysiology ng COPD natin. Okay, isa sa mga terms na ginagamit sa board exam is progressive airflow limitation. In fact, may board exam question tayo na nag-ask doon, what is the common disorders that is associated with progressive airflow limitation? And ang sagot doon is your chronic bronchitis or either emphysema. Bakit tinawag silang progressive airflow limitation? Progressive in a sense that it happens in longer periods of time. Okay? Imagine this, hindi naman siguro first time mong nigarilyo, isang stick ng sigarilyo, magkakasakit ka na agad. Okay? Hindi nangyayari yan. Ang nangyayari instead is that all throughout you develop the habit or habitual smoker ka na, you develop this chronic irritation sa airway mo. Kaya ang nangyayari, nag-i-irritate ang airway, kaya pag-usapan natin naman yan mamaya, nag-i-irritate ang airway, nagsiswell siya due to the inflammatory response, and nalilimit yung airflow mo or daanan ng hangin papunta sa baga. Okay? That's why it's called progressive airflow limitation. Okay? Ang progressive nature ng COPD nyo is airflow limitation is usually, okay, progressive nature daw. Progressive airflow limitation in COPD is usually progressive, meaning nangyayari siya all throughout the years. It's not acute, meaning hindi siya nangyayari eventually, okay? Ngayon, tinik ko yung sigarilyo, hindi nangyayari yung sakit in this moment. Nangyayari siya as I go on developing the habit of smoking. Okay? And it's very severe because smoking, as we all know, is addictive. And so, when a person starts to develop the habit and the addiction of smoking, the person usually has difficulty waning or i-detach yung sarili niya sa pag-smoke. Okay? So, yun yung nangyayari sa COPD natin. That's why it's progressive in its presentation. So, ano ang common na mga COPD disorders natin, guys? We have two, usually, that is associated with, this is specifically stated in your Brunner's and Sordar's 12th and 13th edition. Sabi niya, emphysema and chronic bronchitis are usually the overlapping diseases that are associated with COPD. I-check nyo yung notes ko. I-check nyo yung notes natin sa Brunner's and Sordar's kung hindi to specifically stipulated doon. Okay? I dare you to check our notes, the credibility of the notes na binibigay ko sa inyo sa YouTube channel na to. I dare you to check it and countercheck it in your Brunner's and Sodart nang doon talaga that emphysema and chronic bronchitis are specifically stated as the two common progressive airflow limitation and therefore your COPD. Okay? Your COPD or emphysema, these are a chronic bronchitis and emphysema are overlapping diseases. Okay? What do you mean by overlapping diseases? Yung mga signs and symptoms nila kadalasan at saka yung progression or anong nangyayari sa katawan as the disease progresses are pari-pariha lang. Okay? Pari-pariha yung progression, pari-pariha yung cause, pero may mga bagay nakita tayo na there are slight differences. Kaya nangyayari, differentiate natin siya kung anong emphysema at saka chronic bronchitis. Pero yung presentation niya, yung characteristics ng disease, usually they are the same. Okay, that's why they are called overlapping diseases. Kaya nagkaroon tayo ng umbrella term na COPD. Yan yung nangyari. Okay? So, there's also another debatable concept. Sabi nila, ang asthma daw is also associated or can be considered as COPD. But it is now typically stated in your Brunner's and Sodart that the coexistence with asthma ang asthma natin, pwedeng to some extent mangyari with COPD. Pwede siya madungan ba? Okay? Pwede madungan ang asthma with COPD, ang sakit. But it cannot be considered a chronic obstructive pulmonary disease because asthma is usually associated with an allergic reaction. Okay? Not a chronic inflammatory response. Okay? It's usually an allergic reaction, although it has an immune component, but it's an allergic reaction, not usually the same with your COPD. But it can coexist. What do you mean by coexist? Pwede siyang makasabay. O kung may COPD ka, pwede mong pag then you ingest some kind of allergic material or pollen ba kaya yan o kaya kumain ka ng allergic foods, pwedeng sumabay ang asthma with COPD. But they have different characteristics. Yan yung sabi ng book mo, or specifically stated in your Brunner's and Sodart. So wag mong kalimutan yan. Okay? Kasi usually yung mga little details na yan yung tinatanong sa board exam natin. Okay? Next is that age and symptom onset. Kailan nangyayari ang COPD? Usually common in patients in middle adults and it increases in age. Usually, makikita natin sa Pilipinas, it usually happens in early years or adolescent. Bakit? Diyan kasi nagsa-start yung habitual usage as the child or as the individual, as the adolescent sees the environment. Nakikita niya yung mga kaklase niya ng nigarilyo, nakikita niyo yung tatay ng nigarilyo, and the child starts to develop the habit of smoking and the symptoms starts to manifest. Hindi pa yan magma-manifest at early adolescence kasi yung COPD, again, remember, it's progressive. Hindi nangyayari immediately yung sakit niya. Okay? It's progressive, meaning nag-accumulate yung aberration mo on towards the symptoms. Okay? So, age and symptom onset, usually nangyayari sa middle adults na. Okay? Sa middle adult age. But the habit of smoking starts usually in the adolescent years. Okay? So, adolescent years yan nangyayari. Okay? Now, ano bang general pathophysiology? Okay, pag-usapan natin. Ano ang general pathophysiology ng ating COPD? In general, including na dito yung chronic bronchitis at saka emphysema. Ano ang general pathophysiology niya? First, you have the introduction of noxious particles. Ano ang ibig sabihin ng noxious particles? Noxious particles are particles that are irritating. Okay? Kung anong gustong ano kayang pwede kong maging example nito, okay? Noxious particles. Ang kailangan niyo lang tandaan sa noxious particles, guys, is usually hindi yan nakikita normally sa airways natin. Okay? Ibig sabihin yan, like for example, may nakikita ka bang dust or smoke sa airways natin? Hindi, okay? So when you introduce dust or smoke into your airways, it's noxious, meaning it's an irritant in there, meaning it's a foreign agent in there. Okay, so noxious particles usually originate from smoke or pollutants. Okay, those are what you call noxious particles. When noxious particles enters the system, it causes an inflammatory response. Anong ibig sabihin ng inflammatory response? Do you remember your localized adaptation syndrome? Okay, there is an increase in the number of white blood cells, specifically your Ben10, your basophils, eosinophils, and neutrophils. Okay, those are the common inflammatory responses. Ano pa? There is swelling, okay? May pamamaga na nangyayari, okay? So, the inflammatory response is initiated. Next, what happens is there is an affectation in the proximal, the peripheral lung parenchyma. Anong ibig sabihin yan? Okay, yung daanan ng hangin mo, okay, yung airways mo mismo, doon nangyayari yung inflammatory response. Meaning, yung daanan ng hangin mo, doon siya, yun yung namamaga. Kasi yun yung una na i-irritate. Unang-una na tinatamaan ng mga particles or noxious particles like smoke, like irritants or pollutants mo. So, anong nangyayari? You develop a compensatory mechanism. There is usually an increase in what you call your goblet cells. Anong goblet cells? Anong ibig sabihin ng goblet cells? There is an increase, okay? There is an increase in production. The goblet cells increases production of your mucus. Okay? What is your mucus? Yun yung plema mo. Yun yung mga fluid na usually, okay, again, I just want to clarify, siguro sa mga estudyante natin, no? Mucus is a good protector of your airways. Hindi yan siya associated with usual. Your mucus mo is not directly correlated with diseases, okay? Your mucus is actually a protective layer in your airways that is tasked or functions to moisten, at the same time prevent the airways from accumulating dust, dirts, and other substances. Okay, kaya ang mucus mo usually kapag marami na siyang nalalanghap na smoke, na pollens, na mga usually na mga dust, ang ginagawa natin, inuubo natin siya at saka niluluwa natin yung mucus natin. So mucus is not usually it's not usually a marker of a disease process. But but kailan siya nagiging marker ng disease process? When the mucus is abnormal, when its thickness is abnormal, when its tenacity is abnormal, and its amount is abnormal. Yan lang yung dyan lang natin masasabi na mucus is now correlated with a particular disease process. And maraming disease process that are in relation to increase mucus production. And in this case, there is the blood cells increases the exudate or yung plema mo and causes the narrowing, or when you have a lot of mucus, yung plema mo yung sinasabi ko, pag may marami kang mucus sa airways mo, hindi makadaan ng maayos yung yung air mo or your oxygen, hindi makadaan ng maayos sa airways mo. So ang nangyayari, there is decreased oxygenation, okay? And then this inflammatory response again causes mucus hypersecretion in the proximal airways. Yan yung sinasabi ko sa inyo. Yung napakaraming mucus na sinisecrete na kasi patuloy kang nagsusmoke, patuloy kang nag-inhale ng irritant towards your airway. So that's why you have this compensatory hypersecretion in your proximal airways. So, anong nangyayari kapag hindi yan naagapan? There is usually damage causing tissue scar formation. Okay, there is what we call ongoing injury and repair processes leading to the narrowing or the end-way of lumen. Anong nangyayari? Patuloy niyang nagnanarrow or lumiliit yung daanan ng hangin na nagkukos ng alveolar destruction. Anong ibig sabihin ng alveolar destruction? Okay, there is already damage to your air sacs. So, and if you review your anatomy and physiology, your air sacs is the site of gas exchange. Okay, when there is damage to the air sacs, you have impaired gas exchange. Okay, there's also the destruction of the alveolar attachments, and also decrease in elastic recoil. Okay? There is decrease in elastic recoil. At pag-uusapan natin yan, anong purpose ng elastic recoil nyo. Okay? And lastly, there is then the manifestation of gas imbalances. Okay? Imbalances of gas exchange. Okay? Hindi na makadaan ng sakto yung air mo patungo sa lungs mo. Ang nangyayari, wala ng proper gas exchange in the airways. Okay? So may gas imbalances ka na. Okay? So yan yung nangyayari. That is the general pathophysiology of your COPD. Okay, so pag-usapan naman natin ngayon ang isa sa mga common COPD diseases, and that is chronic bronchitis. Okay, ano ba tong chronic bronchitis? Okay, according to your book, your Browners and Solders, chronic bronchitis is defined by a cough and sputum that lasts for 3 months in 2 consecutive years. So kapag may ubo ka or kapag marami kang plema, okay, increase in mucus production that lasts for 3 months. 3 months ka nang inuubo, okay? In 2 consecutive years, okay? In 2 consecutive, anong ibig sabihin ng consecutive? Consecutive, magkakasunod-sunod na taon, okay? So 3 months in 2 consecutive years. Now, that is the definition. A cough or a sputum in 3 months for 3 months in 2 consecutive years. That is the definition of your chronic bronchitis. Okay, chronic bronchitis is caused by the inflammation. Okay, there is usually an inflammation. Okay, anong ibig sabihin ng inflammation? There is pamamaga. Okay, there is inflammation and hypersecretion of mucus due to the irritation from the smoke or pollutants. Ibig sabihin, sa parati mo, okay, as you go on to smoke, as you go on to inhale more and more irritants via smoking, via vaping, via the ingestion of foreign matter or some pollutants, there is constant irritation. Okay, there is constant irritation in your airways, causing inflammation and as a consequence, hypersecretion of your mucus. And dito rin natin nakikita na goblet cell pa rin. Goblet cells and mucus-secreting glands increase in number as well as in secretion. So ang nangyayari dyan, guys, ang nangyayari ganito. There is mucus plugging, tawag dyan. Mucus plugging and bronchial wall thickening. So nakikita natin dito, sa screen natin na yung mucus and ang daanan ng hangin natin ay napakaliit na due to the amount of mucus or yung plema na nakabara sa daanan ng hangin. That is what you call your mucus plugging. Okay? That is what you call your mucus plugging. Now guys, okay, and bronchial wall thickening. Mucus plugging and bronchial wall thickening. So anong nangyayari, guys? Anong nangyayari? There is usually alveolar damage and fibrosis. Anong tinatawag nating fibrosis? Nagsascar siya. Okay, there is scar formation. Causing impaired function. There is also what you call impaired function of alveolar macrophages. Ano bang trabaho ng alveolar macrophages natin? Your alveolar macrophages are white blood cells. WBC yan sila. They are white blood cells. They function to ingest and phagocytize. Anong ibig sabihin ng phagocytize? Kinakain nila yung mga foreign matter, yung mga dust na pumupunta sa airways natin. Kaya nililinis nila yung airways natin. Kapag walang alveolar macrophages, ang nangyayari, you have increased susceptibility to respiratory infections. Mas madali ka nang dapuan ng sakit, mas madali ka nang dapuan ng karamdaman associated with your respiratory system. Okay, because you have impaired ability to defend. Okay, because you have impaired function of your alveolar macrophages. Okay, there's also acute episodes that happens in chronic bronchitis. And acute episodes, okay, this is specifically stated in your Browners and Solders. Again, the acute episodes of chronic bronchitis. Pag tinanong to sa board exam, what are the triggers of acute episodes of chronic bronchitis? Ang sagot dyan, they are caused by agents that usually causes fever and infection. Kagaya ng viral, bacterial, and plasmal infections. Okay, these are the causes of acute episodes of chronic bronchitis. And usually, the most common na cause ng acute episodes ng chronic bronchitis natin is what you call your um, Haemophilus influenza. Kung viral, okay? Influenza, yung flu natin. Kaya usually kapag may flu tayo nakikita natin na ah, yung tao, yung pasyente inuubo din, maraming plema, sinisipon because your influenza also has a bearing or high affinity to your upper respiratory tract. Ano pa? Kung bacterial infections naman, ang most common bacterial infections na nakakaapekto sa atin at ang cause ng acute episodes of chronic bronchitis is your Streptococcus pneumoniae na agent. Okay? So now, pag-usapan naman natin kung ano ang pathophysiology. Ano nga ba ang progression ng ating chronic bronchitis? Usually, pari-pariha pa rin naman. There is usually the ingestion of irritants. Anong form ng irritants natin? Yung smoke, yung mga pollutants natin. Those are the common associated irritants that are associated with the development of chronic bronchitis or in general your COPD. So there is increase in mucus production. Okay? Dumadami yung plema natin, dumadami yung amount ng secretion sa airways natin, kaya nagnanarrow or lumiliit ang airways natin, guys. Nagnanarrow at lumiliit yung airways natin. And as a consequence to that, there is impairment in gas exchange. There is usually impairment in gas exchange causing chronic hypoxemia. Anong ibig sabihin ng hypoxemia? What do you mean? Question. Kung maganda yung foundations ng ating anatomy and physiology, what do you mean by hypoxemia? Hypoxemia is a low oxygen level in the blood. Okay? Low oxygen level in the blood. At especially, okay, kapag na-detect ng katawan natin that there is chronic hypoxemia, may compensatory mechanism, may pangbabawi. Bumabawi yung katawan natin dyan. Ang ginagawa niya, kinukonstrict na yung ugat sa ating lungs. There is usually what we call compensatory pulmonary vasoconstriction. Now, this is good in itself. Bakit? Ano bang na-detect ng katawan natin kapag may chronic hypoxemia? Anong sinasabi ng brain or yung katawan mo? Sinasabi niya, bakit ang baba ng oxygen content ko? Siguro walang dugo na dumadaloy sa lungs ko. So, ang gagawin ko, magkukonstrict ako ng mga blood vessels sa lung ko. Okay? So, that's why you have pulmonary vasoconstriction. This is good in itself to increase the flow of blood. Okay? This is to increase the flow of blood in the lungs. The purpose of that. But it has a downside. Bakit? Anong ginagawa niya? It also increases the resistance in the pulmonary arteries. Pag nangyayari yan, you increase the pressure on the right ventricle. Okay? You increase the pressure on the right ventricle. And when pressure on the right ventricle is increased, kapag nag-overwork, tinatawag natin yan, overworking of the right ventricles, you have right ventricular hypertrophy. Okay? You have right ventricular hypertrophy. Anong ibig sabihin? Lumalaki yung right ventricles natin. It's not a good sign. Bakit? Bakit? Hindi effective. Okay. Hindi sa lahat ng panahon na ang muscles natin kapag lumalaki, your heart is a muscle, right? Kapag lumalaki ang muscles ng tao, usually ang common misconception is kapag lumalaki ang muscles ng isang tao, lumalakas siya. Okay? But it's not usually the same with the heart. Okay? Because your heart is a smooth muscle. So, anong nangyayari kapag lumalaki or namamaga yung muscles natin sa heart? Ang nangyayari, guys, mas less ang pumping power niya. Hindi na siya nagkukontract na maayos. Kaya ang nangyayari, there is usually backflow of blood in the systemic circulation. There is backflow of blood in the systemic circulation causing what you call your edema. Okay? Your edema. Okay, sir, may edema pala sa COPD. Yes, there is edema in COPD or in general your chronic or specifically your chronic bronchitis. Okay? So, yung edema natin plus your impaired gas exchange causes cyanosis. Anong cyanosis? Anong color? Okay, anong kaibahan ng pallor at saka cyanosis? Okay? Anong kaibahan ng pallor at saka cyanosis? Ang pallor is usually the hazy white discoloration of the skin or the mucous membranes. But when you talk about cyanosis, it's the bluish. Yes, very good. Your bluish discoloration of your mucous membranes or your skin. So edema causes, edema, pamamaga, pamamaga, especially in the lower extremities. Ang makikita ng nurse dyan, there is bloating. Okay, bloating. Bloating. Anong ibig sabihin ng bloating? Lumalaki. Okay, lumalaki yung mga extremities. Ang cyanosis, there is bluish discolorations. Bluish discolorations. Kaya usually, yung nickname ng mga may chronic bronchitis is what you call your blue bloaters. Okay, blue bloaters. Okay, very good. It's your blue bloaters, and that is the cause because of the decrease or impaired gas exchange, and because of the development of edema, because as a consequence of the right ventricular hypertrophy. Okay, what you call your core pulmonale. Okay, wag niyong kalimutan yan, guys. Wag niyong kalimutan yan. Okay, mark it with a red highlight. Your core pulmonale. Okay. Next, guys. Next. Okay. Next is what you call your emphysema. Ang emphysema naman, anong nangyayari sa emphysema natin, guys? Emphysema is usually caused by alveolar wall destruction and air spaces distension. Anong ibig sabihin ng distension, guys? Anong ibig sabihin ng distension? Pag-usapan natin yan mamaya, yung distension. When you have alveolar wall destruction, again, ang alveoli mo, that is the site of gas exchange, 'di ba? Yung alveoli natin, okay? Yung alveoli natin, guys, that is the site of gas exchange. Okay, yan yung tandaan natin, gas exchange. Kapag may destruction sa alveoli, anong nangyayari sa gas exchange natin? There is usually impaired gas exchange. There is reduced oxygen diffusion and increased dead space. Specifically stated in your book, in your Brunner's and Sodar's, that there is increase dead space. Anong ibig sabihin ng dead space? Dead space, guys, in your anatomy and physiology is the amount of air, okay, the volume of air that does not participate or hindi nagagamit sa gas exchange. So meaning, ini-inhale siya, okay? Ini-inhale mo yung air, pero hindi nagko-contribute sa gas exchange. So, ibig sabihin, useless yung pag-inhale mo ng air. Bakit nga? Because there is destruction in the alveolar wall or the site of gas exchange. Nag-i-inhale ka lang ng inhale, hindi mo na gagamit yung hangin. Okay? So what you have is the development again of hypoxemia, low oxygen level in the blood. Okay? Low oxygen level in the blood and your hypercapnia. Ano yung ibig sabihin ng capnia? Capnia or increased carbon dioxide. Bakit? Related to. Inversely proportional yan. Inversely, kapag dumababa yung oxygen levels mo, tumataas naman, usually, yung carbon dioxide mo. Because your cells, as a consequence of metabolism, nagre-release sila yan ng carbon dioxide. Kaya kapag yung alveolar wall mo destroyed, which is the site of gas exchange. Anong ang usual gases na ini-exchange dyan? Your oxygen and carbon dioxide. Kapag hindi mo na i-expel yung carbon dioxide mo, nag-accumulate yan sa blood. And that is why you have your hypercapnia. Very good. And then, you have your ventilation and perfusion derangement. Okay? Causing or as a consequence, developing chronic hypoxemia, hypercapnia, and polycythemia. Ano bang ibig sabihin? Sir, anong ibig sabihin ng ventilation and perfusion? Okay. Very good question. Magtanong tayo. Okay. Anong ibig sabihin ng ventilation and perfusion? When you talk about ventilation, guys, it refers to the flow of air into the alveoli. Okay? The flow of air into the alveoli. When we talk about perfusion, on the other hand, is the flow of air into the ugat or your arteries. Okay? So, into the alveoli and, okay, when we talk about ventilation, alveoli. Okay? Alveoli. Okay? Alveoli. Okay? There is B. Okay? Ventilation, V, alveoli. Talk about perfusion, air. Okay? R. Okay? Na ay A. Okay? R. Okay? perfusion dito sa imuhang arteries. Okay? Air into the arteries. Okay? There is air into the arteries. So, usually guys, usually in normal setting, yung ventilation and perfusion natin, usually equal yan siya. The amount of air that enters the alveoli is equivalent also in the ratio and proportion to the amount of air that gets into the arteries. Yes, very good. Now, kapag may emphysema ka or in general, chronic obstructive pulmonary disease, there is imbalance. Okay? Hindi, okay, bakit nga? Because there is increased dead space eh. Okay? Yung ini-inhale mo na hangin, hindi na yan umaabot sa ugat mo. Okay? Hindi na yan umaabot sa ugat mo. It is trapped. Okay? It is trapped. Again, there is air trapping. There is air trapping in the alveoli. Okay? Causing chronic hypoxemia, hypercapnia. Again, anong hypercapnia? Increased carbon dioxide and polycythemia. Ano ang polycythemia, guys? Bakit may polycythemia? That's the question. Okay, again, bakit may polycythemia sa COPD or in specific sa emphysema? Bakit nagkakaroon tayo ng polycythemia? Okay, that's past board question yan, guys. Okay, so kung may makasagot yan, kung nasagutan nyo in the other side of the screen, that's a very good indication that you have a very good foundation in your anatomy and physiology. It's because when you have less oxygen in the body, okay, when you have decreased, okay, erase muna natin to ha, erase muna natin. When you have decreased oxygen in the body, guys, when you have decreased oxygen in the body, your body signals your bones or your hematopoietic system specifically. Your body signals the hematopoietic system to increase the number of RBC, to make more RBCs. And that causes the development of polycythemia. What do you mean by polycythemia? Increase in the number of RBCs. Kapag less ang oxygen, again, bakit nagde-develop tayo ng polycythemia? Because there is less oxygen due to the imbalance in ventilation and perfusion. Okay? There is less oxygen going into the arteries and into the system. So anong ginagawa ng system natin? Gumagawa tayo ng mas maraming RBCs in order to compensate. Yan yung nangyayari. Very good. Very good, guys. Kung nasagutan nyo yan, that is a very good indication that you have a very good foundation in your board exam. Okay? Or in your anatomy and physiology. Now, let's talk about the pathophysiology. Again, first, okay, again, irritants pa rin yan, guys. Irritants pa rin ang cause ng ating emphysema. Ano nga yung sinabi natin kanina sa umpisa? Because your emphysema and chronic bronchitis are usually have the same characteristics. They have the same presentation and same characteristics. That's why we usually associate with that in general your COPD, your chronic obstructive pulmonary disease. Very good. Okay, so when there is increased irritants or there is an introduction of irritants in the body, you cause an increase in mucus production, kagaya din ng chronic bronchitis natin. And there is na narrowing of your air passages. But more specifically, when there is increased mucus production, dito nagda-diverge yung pathophysiology natin. There is alveoli damage. Diretso na tayo sa alveoli damage, guys. Okay? Diretso na tayo sa alveoli damage. Diyan naman patungo lahat. Okay? When there is increased irritants, may alveoli damage na. Okay? Kapag nagsusmoke ka, usually, ang tinitiran yan, yung site of gas exchange, usually your alveoli. Kapag nangyayari yan, you lose your elasticity. You lose the elasticity. Ano may ibig sabihin ng elasticity? Yung rubbery, when you talk about the word elasticity, when you cite the word elasticity, what comes into your mind? Okay? What comes into your mind when you talk about the word elasticity? It is the ability to inflate and deflate. Kagaya ng rubbery material na nakikita natin sa mga gulong natin, sa mga tires natin, guys. Okay? Nakikita, it's the ability to inflate and deflate. And more specifically, kasi guys, ang ating alveoli, ang purpose niyan to inflate when you inhale and deflate when you exhale in order for you to pump air into the system and at the same time pump out of the air out of the system, your carbon dioxide. So, when they lose their elasticity, the alveoli loses their elasticity, the alveoli tends to stay inflated or deflated. Either way, yan yung nangyayari. So ano yung nangyayari dyan? Kapag the alveoli stays inflated or deflated, the air cannot get in or cannot get out. Okay? That's just the gist eh. Okay, di na kailangan natin i-overcomplicate yung pathophysiology natin. Okay? The air cannot get in and cannot get out. And so there is the development of what you call your air trapping. Okay? There is what you call your air trapping. Now, this is where it gets interesting. Bakit? Okay, this is where usually we draw the line between what the patient is developing. It's either emphysema and chronic bronchitis. Okay, because when there is air trapping, ang mga pasyente mong may emphysema, they usually put effort into breathing more. Okay? Nag-e-effort sila na ma-sustain yung oxygen concentration nila. Okay? Okay, nag-e-effort sila and they use usually what you call your accessory muscles. Okay, your accessory muscles, like for example, sternocleidomastoid, your trapeze, ano pa, your erector spine, your pectoralis major, your pectoralis minor. Those are accessory muscles that are associated with your breathing. When you use those, okay, there is increased energy expenditure, di ba? Kapag nag-use ka ng muscles in order to breathe, which is usually breathing should be naturally, di ba? Especially during the exhale and inhale. I mean, during the exhale, it should be a natural progressive rhythm. Now, because you have emphysema, because you have air trapping, you need to expend more energy. Okay? Ano pang ginagawa ng mga pasyente natin? Nagpo-pursed lip breathing sila, guys. Nagpo-pursed lip breathing. Okay, anong ibig sabihin ng pursed lip breathing? Do you know how to whistle? Okay? Okay. Whistle, baby, let me know. Okay. If you know how to whistle, you put your lips together now. You put your lips together. And then what happens is that there is what's happening when you try to pursed lip breathing. Okay? What's happening? You increase your airway pressure. Okay? You increase the pressure in the airways, and this act of pursed lip breathing actually prevents the collapse of the alveoli, okay, in the lungs. It prevents the collapse of the alveoli in the lungs. So there is both the use of accessory muscles and pursed lip breathing, okay? So the patient usually in emphysema, hindi kagaya ng blue bloaters natin kanina, na there is less oxygen concentration due to hypoxemia, di ba? There is less oxygen concentration kasi hindi makadaan yung hangin papunta sa alveoli. Itong emphysema natin, they have close to normal, okay? Close to normal na oxygen concentration. Okay? Because they tend to expel more energy. They accommodate by the use of accessory muscles and pursed lip breathing. So meaning may close to normal to minimal oxygen saturation sila. Okay? So, plus, yung sabi natin kanina, they have polycythemia, di ba? Polycythemia. Okay? They have polycythemia. So, when you, ang ginawa ng mga mnemonic makers yan, they associated the color of the blood, which is red or pink, okay? They associated the color of the blood, which is pink or red, with the action of emphysema. Okay? So, emphysema now, they made a nickname for emphysema. Okay, for those patients that had emphysema. They now call the emphysema patients as pink puffers. Bakit? Nagpa-puff sila, nagpa-pursed lip breathing sila. Tsaka pink. Bakit? Kasi well oxygenated at the same time may polycythemia sila. Kaya tinawag silang pink puffers. Okay, naintindihan ba? Okay, very good. Okay, very good. Next, what are the types of emphysema? There are usually two types. This is a low yield. Anong ibig sabihin? Usually hindi lumalabas, but it pays to know what the types of emphysema are. First, we have panlobular, or what you call pansinar, at saka centriliolubular or centroacinar na emphysema. When we talk about panlobular, it's characterized by increased air spaces, okay, with minimal inflammatory disease. There is usually minimal inflammation in these types of emphysema. When you talk about centrolobular emphysema, these are pathologic changes mainly in the center of the secondary lobule. Usually in the secondary lobule to nangyayari. And what are the common what are the common presentations of emphysema? Usually there are respiratory failure. This is according to your Brunner's and Soder's, the common presentations, okay, or the common, um, and it's indicated there. What are the common complications of emphysema is respiratory failure and cyanosis. There is central cyanosis and peripheral edema development. Okay, in general with COPD and emphysema. Next is what are the risk factors in COPD in general? Okay, in both chronic bronchitis and emphysema. First you have smoking, because in smoking you depress the scavenger cell activity, which are your macrophages, yung diniscuss natin kanina, yung macrophages na kumakain ng mga foreign matter sa lungs mo. Okay? You depress their activity, decrease their activity, and therefore you have more obstruction, more irritation, okay? More foreign matter that cannot be eliminated, and it causes obstruction and airflow lung damage. Okay. Next is what you call your environmental exposure to pollens or your pollutants. Okay, like for example, dust or chemical, indoor and outdoor or air pollution usually. Next is your genetic risk factor for specifically emphysema. Your alpha-1 antitrypsin deficiency. Bakit? Ano bang ginagawa ng alpha-1 antitrypsin? It has a bearing on the elasticity ng inyong alveoli. At the same time, it has a protective mechanism. Okay? So when you have alpha-1 antitrypsin deficiency, you are more susceptible to damage, and at the same time, you are more susceptible to the development of emphysema. Yan lang yung kailangan yung tandaan. So anong clinical manifestations? Okay, sinama natin tong dalawa. Anong clinical manifestations ng dalawang COPD na to? First, you have chronic cough. Chronic cough production. Okay? Like chronic cough or sputum or paggrami ng plema. Okay? Paggrami ng plema na naproproduce sa baga natin. So anong gagawin natin? Encourage coughing and expectoration. Encourage coughing and expectoration. Ano pa? Encourage ka. Okay. I'm sorry for that. Okay. This one. Okay. Okay. It's meant to be dyspnea. Okay. Kapag dyspnea or difficulty breathing. Okay. Dyspnea or difficulty breathing. Kapag may dyspnea yung pasyente mo, what you do is you limit activity. Okay. You limit or you schedule the activity. Nandyan lang yan yung answer. You limit or you schedule activity. Okay. Next is symptoms worsen over time. Anong gagawin mo? Because of course, the chronic obstructive pulmonary diseases, again, are progressive in nature. So meaning, pag lalong tumatagal yung disease mo, hindi mo na-treat, ang mangyayari is gumagrabe or lumalala yung sakit na yan. Okay? So symptoms worsen over time. So anong gagawin mo? You monitor respiratory status of the patient. How about when there is weight loss due to dyspnea? Okay. Bakit may weight loss, sir? Bakit may weight loss sa COPD? Kapag may COPD ka, okay? Kapag may COPD ka, mas marami kang energy expenditure. Bakit? Kagaya ng diniscuss natin sa emphysema kanina, na grabe ang energy expenditure na because the patient is using the accessory muscles. Okay? So there is usually increased energy expenditure that contributes to weight loss. Ano pa? There is difficulty eating. Bakit? It's not the same as dysphagia, which is difficulty swallowing. Dyspnea, difficulty eating, because the shortness of breath, the fatigue, and the muscle weakness makes it physically challenging for the patient or the individuals to eat. Okay? This can result to weight loss. Okay? This can result to general wasting or weight loss. So anong gagawin mo? Encourage frequent or small frequent meals, small frequent feedings. Okay? So ano pa? Dyspnea becomes severe or interferes with activity. That's when we use our supplemental oxygen. Okay? Administer oxygen. So yan yon. Okay, ano pa? Anong assessment and diagnostic findings natin dito? First, we have your history. Okay? Ask the patient about smoking history, exposure to secondhand smoke, and other risk factors kagaya ng genetics natin. Okay? Next is physical exam. Look for signs of respiratory distress such as shortness of breath, wheezing, and cyanosis, as well as ano pa? Dyspnea, ano pa? Ano pang association of respiratory distress? Ano pa? Okay, difficulty stating words or speaking. Yan. Yan ang example ng presentation of your dyspnea or difficulty breathing. Ano pa? Pulmonary function test. Okay, specifically incentive spirometry, which is used again. Incentive spirometry, guys. Okay, your incentive spirometry is to measure airflow obstruction or kung gaano na ba kalala ang gaano na ba kaliit, okay? Gaano na kaliit yung daanan ng hangin. Yan yung mini-measure niya. At usually, it's not usually questioned in the board exam, but it pays to know, okay? In patients with COPD, guys, in patients with COPD, you see a decrease in the amount of air, okay? In the amount of air that can be exhaled. And that is called your forced expiratory volume. Okay, forced expiratory volume in 1 second. So forced expiratory volume 1. Okay, so in patients with COPD, bababa yung forced expiratory volume mo. Okay, because okay, ang kailangan mo lang tandaan, guys, okay, ang kailangan mo lang tandaan dito is that the lower the forced expiratory volume, the more severe the COPD will be. Okay, the lower the forced expiratory volume in 1 second, the more severe the COPD becomes. Okay, yan yung kailangan yung tandaan, because forced expiratory volume, a decrease in the forced expiratory volume, a decrease in this means that airways are narrowed and inflamed. Okay, yan lang yung kailangan nating tandaan. Okay, ano pa? Chest X-ray, okay? Chest X-ray. Anong makikita natin sa chest X-ray? We may see in chest X-ray what you call your hyperinflation, or yung mga alveoli mo naka-inflate lang palagi, hindi siya nagdi-deflate, because again, in COPD, specifically your emphysema, there is the loss of elasticity. Ano pa? There is bulle. Kagaya nitong pinapakita ko ngayon sa screen. That's called your bulle. Okay, anong ibig sabihin yan? There is air spaces. Okay, there is usually air spaces na nagtatrap ng air sa alveoli mo. Okay, or alveoli in large spaces in the lungs. That means na hindi nag-i-exchange yung air dyan. And that means that you are developing your emphysema. Okay, your emphysema. Ano pa? Okay, screening for alpha-1 antitrypsin deficiency. Okay, yun yung sinabi natin na may genetic component yung isa sa mga COPD, which is specifically emphysema. Ano pa? COPD staging, which is based on the severity of airflow obstruction. Hindi nyo na kailangan tong i-memorize kasi yung COPD teaching nyo usually is associated responsibility with your physician, not the nurse. Okay, pag-usapan na lang natin kung ano ang common na mga complications ng COPD natin, guys. Okay? Isa sa mga common complications is respiratory efficiency. Okay? Anong ibig sabihin ng respiratory efficiency? And for one, it is the most or the major life-threatening complications. Ito yung nakakamatay talaga sa COPD natin. Anong nangyayari ba sa respiratory insufficiency? The lungs are not able, okay? What happens is the lungs are not able to provide enough oxygen to the body, and so there is impaired oxygenation in the whole system. Okay? Ano pa? Pneumonia. Bakit nagkakaroon ng pneumonia in your COPD? And this is more specific to chronic bronchitis. Because when there is pooling of your mucus, di ba? Sinabi natin kanina, there is mucus pooling. Okay? When there is pooling of your mucus in those areas, the mucus becomes a haven or a pool na pwedeng pamugaran ng mga bacteria and can cause infection. Yan yung nangyayari. And there is the development of your atelectasis. Anong atelectasis? Lung collapse. Okay? Chronic lung collapse. Ano pa? Cor pulmonale. Yung sinabi natin, right side failure caused by pulmonary arterial hypertension. Okay? So anong prevention natin dito? Isa sa mga common preventions that are associated with the responsibility of the nurse is to teach smoking cessation principles. The most important intervention to reduce the risk of COPD, especially in the Philippines, is to stop smoking, which is the most common irritant, the most common agent na nakikita natin sa mga pasyente nating may COPD. Okay, paano mo sinastop ang smoking? Your cigarette smoke. You administer nicotine replacement therapy, okay? Which is the first line specifically stated in your Brunner's and Sodart, the first line pharmacotherapy for smoking cessation. Okay? Anong mga uh, anong klaseng mga nicotine replacement ang stated sa book nyo? Including gums, lozenges, patches, and nasal spray na may nicotine na in lesser amounts. Anong ginagawa natin? Bakit ba nag-nicotine replacement therapy? Anong ginagawa ng nicotine replacement therapy? Nicotine is highly addictive. But you don't cold turkey. Anong ibig sabihin ng cold turkey? Abruptly stop taking nicotine. Bakit? Because it may develop your withdrawal symptoms. Okay? So, anong ginagawa natin? Nire-replace natin yung oxygen content in lower and lower doses over time. Okay? That's why this is the main premise of nicotine replacement therapy. Okay? Other pharmacologic treatments or agents include propofol, nortriptyline, and clonidine, and varenicline. Varenicline specific. I'm sorry. Okay, so these agents, specifically your propofol and nortriptyline, are antidepressants that can help reduce craving. Okay, hindi ka na nag-crave ng sigarilyo or your nicotine. Ano pa? Clonidine. Your clonidine is an antihypertensive, okay, that can help reduce withdrawal symptoms. Okay? Ano pa? And last is your varenicline, which is a medication that works by blocking the effects of nicotine in the brain. So that is your COPD, guys. That is the prevention. That is the pathophysiology. That's the overview of the diseases and in-depth discussion of bakit nangyayari ang mga presentations ng disease process natin. Okay? So thank you for listening for this topic of our free review. Thumbs up, like, and subscribe to our channel. And see you again in the next video. I will still be discussing more about the respiratory system aberration. So thank you guys, and see you next time.